Hi, my name is Ilene. I had a total knee replacement on my right side. I've had pain in my both knees for a few years, and it just got to the point where I wasn't enjoying myself. Before surgery, I enjoy going to the beach, golfing, different sport activities, and it would just be painful. You know, as I'm golfing, like going through like the 11th, 12th hole, I'd be like, I'm done. You know, I had too much knee pain. So I did physical therapy a couple weeks before surgery, and then for the previous few years, maybe 3-4 years, I was doing maybe 2 or 3 cortisone shots a year, or I tried the PRP, and they were kind of temporary fix, but now it's much better. The timing was right. I spoke to Dr. Spagnuola, and after going to him for pain, and he said, listen, you're probably at one of the worst bone-on bones that I can see, so it's time. So we did it. Well, Dr. Spagnuola, I've known him a long time. He's taken care of some other ailments that I've had over the years, and he was just great. He talked me through everything, explained everything, and it worked out pretty well. With my surgery and trying to check into different aspects, and a few people that I know who've had total knee replacement, they told me about their staples, and I saw their pictures of their scars and different things. And when I spoke with Dr. Spagnuola, and he told me that he doesn't use the staples anymore, he uses a glue and then a mesh netting, and it makes it's easier to heal quicker, better, and my scar looks tremendous. It's the prettiest knee replacement scar you can see in a while. Not gonna lie, I was a little nervous, but he kind of explained everything to me, and when I do my left knee, I think I'm gonna be a lot better because now I understand and I know what's going on for going through that. But when we went and did the surgery, he explained everything right there before. I woke up, I opened my eyes, and there was Dr. Spagnuola, so asking me how I was doing, and everything was good. It was just a very good experience. He called me when I went home that night, and he checked in with me a couple days later and told me what to expect as far as knee pain and different things with the bandages and stuff like that. So he prepared me. It was just great. It was a great experience. Wonderful, wonderful. I golf probably once or twice a week now, no pain. It's great. I had my surgery February 23rd, and my goal was to be able to walk the beach and golf by Memorial Day, and I did. I golfed a couple times before that, and I walked the beach no problem. I made sure I did physical therapy 3 times a week for the 3 months that, I still do a lot of the exercises at home now too, just to keep strengthening it, but it feels pretty good. For future patients who are thinking about total knee replacement, I would just say it's not as bad as you think. You might be a little scared and stuff, but just do it. And get yourself determined that you want to be able to do the physical therapy as much as you can, and keep your goal in sight and keep working towards it, but don't overdo it. Take your time through therapy, but I totally would say do it. It's so worth it, pain-free. It's the way to go, and Dr. Spagnuola's the one to pick.